you usually, you would start a massage with the back, but not always. Sometimes you would have massage starting with massaging someone on the leg. Can you think about who would be the clients that would be benefit from massage the legs? Athletes?
Postmen.
Postmen? Yes, good.
Meter reader men.
Meter reader men, yes. Yes. Hairdressers.
People on their feet all day.
People on the feet. Museums, teachers, museums, shopkeepers, those who just being on their feet a lot. All the blood, going there can have quite achy legs and quite other symptoms, yeah? And those who are active, running. It's actually two extremes, isn't it?
Mm.
Okay, so let's just do a bit of revision. So, what's the name of this bone in here? Calcaneus bone, good. And here there are two edges, the two ankle bones. One start the fibula, and the other one start the tibia. Good. On the knee joint, how many bones make the knee joint?
Three.
Yeah. Which one are they?
Femur.
Femur, tibia, and then patella. Good. And the femur goes in here. And a lot of the time, the femur is quite hard to feel because there are quite a lot of muscles. But if you go onto the side, even now, you can go onto your side of the hip, and you feel bones. Yes, do you feel that? Yeah? That's the femur. That's the side of the femur. And then you could feel the hip bone in here. Good. Now, one important thing when it comes to massaging the leg is draping. And for draping, I remind you again how the cushion should be before, when the tip of the toes are dangling on the edge of the cushion. And then you are ready to drape that area. Now, a nice way for now is to take sort of the two edges, yeah? So one parallel to the hip and one at the edge, and just come to here and do that. That's the first thing. Second, you're taking the edge and you tuck it underneath the opposite leg. If you want, come around here to see. It's quite hard from here. Yeah? So I'll do it again, maybe with the camera over here also. Yeah? So, it should be quite simple. So, the lower hand moves a little bit more, but never to expose the other ankle. And then, you can do that maybe a little bit more, and then tuck it under the other leg, so it's quite secured. Yeah. Usually we will work with 2 towels, but we'll show you the technique with 2 towels later. Okay. Good. So again, yeah, the draping is quite important, and sometimes I still see students like doing something like that. So not good, because once you start massaging, it interrupts you, get in your way. Yeah. Good. So let's now start with effleurage. Now, effleurage on the leg is quite easy because the leg is quite long. Sometimes it would be a bit too long, so you need to use a lot of your legs. Yeah, you can do few of these before starting. You can do the feet also, but we're not going to concentrate today on the feet. If it's too much, you can do 2 legs coming this way, or really take one part at a time. Because sometimes you have a client that is very limby. So, yeah, try to get the whole back, the whole leg. So within effleurage, you can do a reinforced effleurage. You can do the two hands side to side, and then the inner hand wraps around the towel. Yeah? Don't start going there underneath the towel. And you do the effleurage on the limb towards the heart. Why do you think? To push the blood back to the heart, yes. The arteries are always easier to go because they are much more in pressure. So the blood would always go out, but in, sometimes it's a little bit harder, especially those that, you know, standing a lot on their feet. You can do also one hand after the other. Yeah. Right, I think effleurage we've done on the back, not much to say. So now we are getting into petrissage. Now petrissage on the limb, because they are narrow, you have sometimes a better grip. So, for example, figure of 8. Yeah? Or ringing. Yeah? Squeezing. Yeah? Now, usually therapists think that they're massaging only the muscles, yes? But actually it makes a lot of sense to also work on the periosteum. Remember what's the periosteum?
Yes.
The cover of the bone. Yeah, because imagine the muscle coming attached to the bone. So sometimes the muscle will pull on the bone too much and it would reduce the blood supply around there. So it's nice to, even on the calcaneal bone, to work there. And you're thinking, why do I work on the bone? But it does make, it energize that area and it will feel quite good.
Yeah, it's
So-
really good.
Yeah. So work on the tendon here, the Achilles tendon. Yeah. So again, figure of 8, ringing. Yeah. And you can do the ringing here also. Good. You can do finger petrissage, finger kneading. And once you do that, also start to listen. I feel a bit of grinding there. Or is it, you know, smooth? Does it feel smooth or there is some bumps there? Good. Good. You can do what we've just learned today. Now, what do you think about the speed? If I go deep, what would happen to my speed? Do I need to slow down or speed up? Slow down, yeah. Because it might be a bit too much. How's the pressure?
Good.
Can I go deeper? Think three-dimensional, so not only in here but also on the side. Good. One thing that was quite hard to do on the back is lifting. So you almost try to move the muscle away from the bone. It's a lot easier on the towel because you don't have the gliding oil. Good. Okay. Now, there are a few other techniques that it's nice to know once you're there, but they are more related to other techniques we haven't learned. Let's say oscillation, shaking, you know, it's nice to do that. So how do you do that? You're taking the leg and you're lifting it, and you're holding the feet this way. And then it's pretty much like shaking them, shaking. And you see what happened to the muscle? Yeah? Good. You can also, at that point, come and massage it in this position. Now, why? Because it's a bit more relaxed this way. Good. You can do it this way, or you can put your leg and then work it with the leg. So I do Petrissage now. I work deeper. I really want to feel the muscles underneath my fingers. Yeah. Then after that, I will continue to the thigh. Pretty much the same thing. Effleurage. It's nice once in a while to have effleurage. Then it's nice to start having some Petrissage. So figure of 8, warming the muscles. Yeah. You can do some ringing. Yeah. And then finger kneading. And what you do really is you go to the area exposed by the towel. One area at a time. And then you can do more. Knuckles. And in a way you're looking to where you put your oomph. And that's based on the effleurage. Effleurage, you feel that area, you're thinking, okay, well, actually I feel a bit more here. So I'll start that effleurage, Petrissage more in there. Slowing down. You can't do the whole body effleurage in an hour. It will take you a long time. So you need to prioritize where to do and where not to do. And it goes by your palpation. Now, let's say Alison is my volunteer, and I've told her that actually now I would do the leg quickly, but I find an area that I need to spend more time there. So we might not do other areas. Do you think I should tell her that? In the middle she's relaxed. And
ask her.
You could ask her, yes. You should actually ask her because it's the consent she needs to give. So I could say, Alison, do you find this area? I find it's very tender.
Yeah.
I need to spend a bit more time in there. So can we say leave the hands to another time or?
Good idea.
Yeah, let's do that. Okay. So and then you continue as usual. Or she could say no, and then say, okay, let me wrap it up, and then you do a bit more effleurage, and then you move on. It could be also. Good. Now we're coming to the glute area, and the glute area you can do two ways. You can do on top of a towel, and you can do under the towel. So I'm going to show you now on top of the towel. And that might be to people that you might feel they're not ready yet, or they're too shy, or you're not ready yet. You want to make it sometimes. Yeah? So the gluteus area, the back of the hip, there is a bone here. You remember how it's called?
Sacrum.
Sacrum, good. And below that there is the coccyx. And then the hip bone travels this way. This is the ilium. And here you would feel the sit bone. You can actually palpate the sit bone. Yeah? And then the femur. So, ischium, yeah? Femur, ilium. Yeah? And in between, there are area covered with muscles. So what you can do more of acupressure approach, in which is also part of Swedish massage, that you just apply some deep pressure. Yeah? You can do that with your base of your wrist, and you can lean on that. Or you can do that with the knuckles. Basically what you're doing there, imagine the muscles like a towel. So if this tightness, you're stretching and you're leaving it. You're compressing, stretching, compressing, until the area start to get more blood into and release the tension. Yeah? So let's do first round, and then after that I'll show you more technique of the limb. Okay? Good. You could probably make sense to stay on the same pairs for the day, and then next time to change. Okay? Cool. Let's continue then.